1 in 2 people will probably get cancer in their lives, and we know that early diagnosis gives us a better chance of survival, why are people not going to get checked?
With breast cancer, if you pick it up on stage 1, most people will be alive 5 years later. Stage 4, 3 out of 10 people will still be alive 5 years later.
What are some of the early signs and symptoms?
Unexplained weight loss, excessive night sweats, a new lump or bump that's appeared, skin changes that are new and persistent, blood in your urine or in your poo. I would encourage everyone to just be aware of those sorts of things.
We don't talk about it, we're scared about it, we don't share about it, and we don't really want to admit it.
It's not your job to decide whether it is cancer or not, because you're not trained to do so. Much rather you came forward and we reassured you than you came forward late, and then your options are very, very different and things get a lot more tricky.
Hey everyone, and welcome back to another episode of Millennial Mind. Today, I'll be having a really important conversation in partnership with NHS England, where we'll be discussing the potential signs and symptoms of cancer, the importance of body awareness, and seeking help early if you notice anything different in your body. Now, I know this sounds heavy and scary, but I'm here with Dr. Ranj, who is an NHS clinician, personality, author, and columnist who's going to break it down for us. He's really dedicated to his healthcare profession, and he aims to spread awareness for mental and physical well-being. So we're here today to discuss some of the signs and symptoms of cancer that you should be aware of and what to do if you have any of these. This isn't a podcast to scaremonger anyone. It's an informative one because anyone can get cancer, but finding it early makes it more treatable and it could really save your life. So the first thing to do if you notice anything unusual in yourself or with someone else is to contact your GP and to get it checked. For more information on cancer signs and symptoms, please go to nhs.uk/cancer symptoms to make sure you're equipped with the best information possible. This episode was really helpful to me, and I'm really hoping that it's going to help you at home too. Thank you so much for always watching the podcast. Let's get into this episode. Ranj, hi.
Hello.
Welcome to Millennial Mind.
Thank you so much. Thanks for having me.
No, of course. I'm so excited to have you here because I think this is a topic that a lot of people are avoiding talking about. They're avoiding listening about. It feels too heavy, too scary. And I think that you're the perfect person to kind of break it down for us, make it a little bit lighthearted, but also deliver a really, really important message as well.
We can definitely try.
So tell me a little bit about this campaign.
So this is all part of the NHS Help Us Help You campaign, which is basically to try and encourage earlier cancer diagnosis and hopefully better outcomes for people. What we want is for people to be more aware of the signs and symptoms of potential cancer, be a bit more self-aware of what's normal for you, and then if there is anything worrying you, speaking to a healthcare professional, ideally earlier rather than later, because when it comes to stuff like cancer, and we're talking about lots of different conditions here, but when we're talking about cancer, usually speaking, the earlier you catch it, the better your outcome might be, because usually it's easier to treat then and you're more likely to survive. And that's the whole point of this campaign, is trying to get people to come forward a bit earlier.
And why do you think people aren't coming forward? Because I think when you put it like that, it seems quite simple to me. We know that, well, the estimated number now is 1 in 2 people are going to get cancer.
Yeah, that's the projection, that
Which
1
is
in 2
crazy.
people will have cancer at some point in their lifetime, which is scary.
Yeah.
Some are a lot more serious than others, but we've still got to be aware of them all.
So if we know that 1 in 2 people will probably get cancer in their lives, and we know that we can detect the signs and symptoms, and we know that early diagnosis gives us a better chance of survival, why are people not going to get checked?
It's complicated. There's lots of different reasons here, and some of them are cultural, especially for South Asian people, and that's one of the things I really want to highlight. So particularly when it comes to, well, as a general thing for everybody, it's access, first of all. Some people are working. They may be working multiple jobs. They may not be able to get into a GP surgery or doctor's surgery to get that check done. So logistically, it can be tricky. But let's talk about some more stuff that's more relevant to South Asian people. Firstly, they don't want to be a burden. That's a cultural thing. They want to be sure before they go and, bother the doctor,
Yeah.
as it were, for want of a better term. They may be scared of a potential diagnosis. Being told that news that you have cancer immediately makes people think of the worst. And especially within South Asian communities where you are much more of a family unit and family is so important, an implication of a diagnosis of cancer isn't just for the individual, it's for the family at large as well.
Yes.
And that has a bigger impact. There's an element of embarrassment. Some cancers affect intimate areas, and we talk about things like breast cancer, testicular cancer, female reproductive cancers, so ovarian, cervical, etc. These things culturally we don't necessarily always talk about. They become taboo subjects,
Yes.
which I think we should change, and we are changing, especially younger. I think Asian generations are changing that, but they're not always easy to talk about, and people do get a bit embarrassed. And I would just say to people, don't be embarrassed. When it comes to things like cancer, yes, it can be embarrassing. Yes, it can be scary, but as doctors, we want to see you. And remember, we've seen it all. We're not going to be surprised or shocked. And we'd much rather you came to us and spoke to us than sat at home and worried about it. And if you've been at home for a very long time and it is cancer, for instance, then chances are your options are going to get less and less the longer you leave it.
I think the embarrassment point is actually a really good point to highlight because I remember on my podcast I had Karina, I don't know if you
Yeah.
know her, but she was diagnosed with breast cancer.
Mm.
And I remember her telling me that her grandmother had cancer, but they never talked about it.
Yes.
And she said that if we had talked about it, maybe I would have known earlier.
That's it.
And I think that that's the point here, isn't it? Is that so often we think that, not knowing is going to change the outcome. And I think this applies with anything. So often we don't want to know the outcome of a situation
Yeah.
because we'd rather avoid it.
We're hoping that if we don't deal with it head on, it will go away.
It will go away, but it doesn't. It just gets worse.
Absolutely.
And then we actually have very little control over it.
Yeah.
So when you do have control of it and you do understand it, you can change it.
Yeah.
But if you just ignore it, and I think this is so relevant to people who are avoiders in life. I do this sometimes. If I have something I need to do, I just think, oh my God, I'll watch Netflix or I'll do something and I'll procrastinate and I'll avoid it. And then this pile just gets bigger and bigger and bigger. And then it is actually uncontrollable. And then I
Yeah.
do feel really bad. And I think this applies in this situation. If you don't go to the doctor and you don't get checked, it might have really adverse effects on you because it
Yeah.
might have spread everywhere else.
Yeah. Yeah.
Which I think is really, really key to highlight. I really want to talk around the embarrassment point a little bit more because how do we change that within our communities? Because I know that having been someone who has, I think, been aware of cancer my whole life,
Yeah.
I've had a lot of family members that have gone through it. The conversation still doesn't change when they get diagnosed because they think, I don't want to tell everyone.
Yeah.
I don't want people to know. I think also for women in their 30s who are diagnosed unexpectedly, because we don't really see, South Asian women being diagnosed in their 30s so often, they're then scared that, well, if I'm not going to have children, my husband won't want to be with me.
Yeah.
If I have cancer before I'm married, no one's going to want to marry me.
Yeah.
That's the conversation that I've heard people have.
Yeah. That will change generationally, I think, as we progress through generations and people become more open talking about these topics. That will eventually get there. But we've got to make an effort. We have to, as South Asian people, we have to make an effort to normalize these conversations, first of all. If you know someone or if you've been affected by cancer, it's a terrible and it's a difficult situation. I'm not going to make light of that. But it's also important for you to talk about it, for you to tell others, especially within our community. Because unless we talk about it, unless we lift the lid on it, it stays as a taboo subject. I understand you're not going to randomly bring it up at a dinner table. It doesn't quite happen like that. It's got to be at an appropriate time and moment with people. But it's important for us to talk about it, and I think that we need more publicly facing people talking about it as well to give others permission to do so.
Right.
We are getting better at it. I will say
Yes.
that, and I think younger South Asian people are a lot more accustomed to talking about these things. But, my parents, my uncles and aunts, grandparents, these aren't things that they necessarily culturally would talk about because to them, cancer is a very bad word.
Right.
And cancer is a very scary word. And to them, cancer feels like it's an automatic, bad outcome. And that's just not true anymore. We are getting better at treating these things. And we are even better at treating them the more we speak about them and the earlier we come forward.
What are some of the early signs and symptoms that allow us to detect whether we have it in our bodies
Yeah.
or not?
So we talk all about being more aware of the signs and symptoms. One thing I want to point out is that cancer is not one thing.
Mm,
Cancer is a group term for over 200 different conditions, and there is no one sign of cancer. All
right.
right. Which is why we talk about being aware of certain things, but also remembering what's normal for you. If there's something that is unexplained that you're worried about, speak to somebody. So things like unexplained weight loss, if you're unintentionally losing weight, excessive night sweats, a new lump or bump that's appeared and is persistent, skin changes that are new and persistent, for instance, if you've got a mole that's changing, or if you've got a sore or an ulcer that doesn't heal, blood in your urine or in your poo.
Mm,
If you've got vaginal bleeding, particularly between periods or after sex or after menopause, that's unusual.
mm,
Testicular changes that are new, things like that. I would encourage everyone to just be aware of those sorts of things. And other campaigns have highlighted if you've got a new or a persistent cough that's lasting longer than 3 weeks, changes in your bowel habits. So if you're constipated, or if you've got diarrhea, or if you've got bloating or persistent tummy pain that's lasting 3 weeks or longer, these sorts of things. In isolation, these symptoms do not automatically mean cancer.
right.
Because with cancer, often you'll have more than one symptom. And even if you have these symptoms, please don't panic, because chances are it's not cancer.
Right.
So if you're sitting at home and you're like, my gosh, I've got that symptom, or I've got those couple of symptoms, don't immediately assume it's cancer,
Mm,
because the probability is that it isn't. But you can't tell sitting at home whether it is
right.
cancer or whether it's something else, or whether
Mm,
it's something completely straightforward to sort out. That's why we would say come forward, have a chat to a healthcare professional who's trained to decide whether it is something that needs looking into or not,
right.
and then we can deal with it from there. Don't sit at home and fret about it or ignore it. Lots of us, for instance, will have heartburn and indigestion, and lots of us will sit at home and try to
Right.
manage it over the counter, which is absolutely appropriate, because
Okay.
vast majority of people, it isn't down to cancer.
Mm,
But there is that small number where it can be. So if something like that has been going on for a long time and you're struggling to manage it and it's causing problems for you, just speak to a healthcare professional and say, does this need looking into, or is this
mm.
just, one of those things that I can manage?
When it comes to getting an appointment, you mentioned at the start it's really difficult, right? So, what if someone's listening to this at home thinking, okay, I have some of those symptoms,
Mm.
but I work 2 jobs and I don't know how I'm going to make an appointment. I'm a bit scared. I'm a bit nervous. I don't really have anyone in my family I can talk to about it because I think I found a lump on my breast and I don't really
Mm.
want to show anyone. I feel really ashamed about it. What do they do?
I totally empathize, especially if you've got a busy life, if you're working a lot, if you've got commitments like family or
Mm,
children. It's completely understandable how difficult it is for you. But remember, this is your health that you've got to prioritize. The thing I want to point out, so if you notice an unusual symptom, and you're like, it could be one of those potential symptoms of cancer. If you go to the doctor, chances are it won't be, and you'll just need a bit of reassurance. Knowing has given you a peace of mind already.
mm,
If it's not, if it's something that needs treating, if it's another condition that we can deal with,
right.
again, that's only a positive thing. If it is cancer and you pick it up early, your treatment options are better, your outcomes are better. So it's a win-win situation if you come forward early. The
Right.
longer you leave it, the longer you ignore it, not only is it going to cause you stress, anxiety, not only could another treatable condition be getting worse, but your outcome, if it is that small proportion of people that have cancer, your outcome is worse. So you're
Mm,
always better off coming forward and speaking to someone. It's great being aware and it's great
yes.
being educated, but you've got to be able to balance it with, the probability of it being something serious. Chances are it probably won't be something serious, but if
Yeah.
it is something that's causing you significant problems, better to be seen than sorry.
Yeah, 100%. What are some of the causes that you see that are most common
Yeah.
as to why people do get cancer?
Because there are so many different cancers, there are so many different potential causes, and often we can't pinpoint a cause.
Really?
Yeah, so a lot of people who get a diagnosis of cancer may blame themselves because they feel like it's something that they've done. And that's not the case. Sometimes there isn't an obvious cause. Sometimes there is, and that may be things like smoking, for instance. That's a classic cause. We know smoking causes lung cancer. We know that, which is why we advise people to stop it. But other things, there are risk factors that can increase your chances of getting cancer. For instance, if you've got a family history of cancer, if you drink too much alcohol, certain dietary factors. So if you've got lots of processed red meat, for instance, we know that can increase your risk. Being exposed to too much sun can increase your risk of skin cancer. So things like that could increase your risk, but often we don't find a cause for it. And actually, when you get a diagnosis, finding a cause for it may not be that important. What is more important is addressing it straight away and getting that treatment, because you're already in that situation now. But for everybody else, that's why we say, right, try to minimize your risk as much as you can. Certain things you can't do anything about. Family history, you cannot do anything about that. But what you can try and do is modify all those other factors. So, stopping smoking, cutting down on your alcohol intake, trying to be as physically active as you can be. Keeping an eye on your diet, trying to eat as healthy as you can, make healthier choices, that sort of thing. I would encourage everyone to try and do those things within reason. We live in a world where things aren't always easy.
Yes.
But try and modify all your other factors. But often we don't find a cause, and it's not your fault. It's really not your fault. And I don't want anyone to sit at home and blame themselves, because that's not fair either. Sometimes these things just happen, and there's nothing you can do about it. Generally speaking, if you're going to recommend a blanket rule for everyone, it will be to try and be as balanced as you can be. Because we only know enough to recommend that at the moment.
It's really interesting you say that, because, I mean, my parents, when I was living with them, every night they would get fruit and they would say, oh, well, it's healthy to have fruit, right? And I hear a lot of South Asian people say this, like my mum chops up fruit for me in the morning, in the evening. Having fruit, which is high in sugar, like mangoes, which, a lot of Indians love mangoes. Would having mangoes at night be bad for you?
The only worry I would have about having fruit and fruit sugars at nighttime is your teeth. That was my biggest concern.
Really?
So if you're going to have fruit late in the evening, make sure you brush your teeth afterwards and before you go to bed, ideally at least twice a day, because those fruit sugars will be present on your teeth and they're not great for tooth decay and things like that. The thing about fruit, what you got to remember is fruit is really good for you. Fruit is, generally speaking. And
why is it? Because I actually don't know the reasons why fruit is good for me anymore.
Fruit is full of fibre,
okay,
which is really good for you. It's full of vitamins and nutrients and lots of other things our bodies love. But fruit is also full of fruit sugar. And that's why it's everything in moderation, isn't it? And everything, ideally at the right time. So having fruit at night isn't bad for you, but remember, it can be acidic. So if you've got reflux, it can make your reflux slightly more tricky. So be careful of that, and obviously watch your dental health with it as well. But the thing about fruit is that it is a good way to consume sugar, because the sugar is all packaged up in fibre.
Right.
And therefore your body metabolizes it in a slightly different way. It's slower to process. It gets the benefit of all the other nutrients. It gets the benefit of all that fibre that's in there as well. There's a big vogue towards juicing and things like that,
right,
which a lot of people believe in. And juicing can be a great way to get more fruit and vegetable into your diet, because you blitz it all together and you have it, and you may not necessarily have it otherwise.
Right.
So that's something, at least that's one way of getting in. But what you need to remember is when you blitz something in a juicer or a smoothie, for instance, you're breaking down all of those packages that are holding that sugar together. So when you have a smoothie or when you have a juice, you will get a rush of sugar, because all that sugar has been freed out and freed up from those individual packages that were in there, and it gets into your bloodstream quickly, so your sugar levels rise, but also they can fall very quickly as well. So is it the best way to get those minerals and those nutrients and those vitamins and stuff? Possibly not. Having it as a whole food might be a better way of accessing all that stuff, but if it is the only way you're getting it, it's better than nothing.
I think this is the tricky part. So when I was growing up, I used to have juice every morning. My mum
Yeah.
used to make carrot, apple, orange, and ginger. It
Absolutely
was
fine.
amazing.
Absolutely fine.
Then there was a stage where everyone was like, stop juicing and make smoothies. So I'm on the smoothie phase, and now I'm like,
Yeah,
God, I better stop my
because in
smoothies.
smoothies you're getting, some people add vegetables to them, they'll add a lot
Yes.
of green stuff to them, they'll add
Right.
even nuts and seeds to them.
Yes.
Great. Do you
Yeah.
know what? If you wouldn't consume those otherwise, then it's better. It is
Right.
better.
Right. It's better than
But
nothing.
it's better than nothing. It's better
Okay.
than not having them. But is it the best way to be having that stuff? It might not be, actually, because you're getting a hit of sugar and you're releasing all the sugars when you blitz them. So if you can have them as a whole food, even better.
Yeah.
Even better. So if you can have a handful of nuts rather than, for instance, well, nuts is different because it doesn't necessarily get that affected when it's blitzed. But if you can have, for instance, a handful of strawberries as opposed to blitzing the strawberries in a smoothie. If you
Wow.
can have, orange segments as opposed to blitzing the orange, it is slightly better. It's a
Okay.
slightly better way of getting it, but you're still getting the benefit of those nutrients either way.
You talked a lot at the start about how you wanted to direct this a lot at South Asian
Hmm.
communities, because I do think, and I agree with you, just because I've done a lot of work in this area as well, is that we don't talk about it, we're scared about it, we don't share about it, and we don't really want to admit it that we've got something, because
Yeah.
it's almost looked at as a bit of a weakness. I've heard someone say that. I was a bit embarrassed of the fact that I'd had it, and I had a friend actually who told me that she was so scared to tell people that she had gone through something because she didn't want their sympathy. Is there a particular sect or a group that's affected more by cancer?
Cancer can affect anyone at any age.
Mhm.
So you can have very young children with it, you can have very elderly people with it. It tends to affect people over the age of 50.
Why is that?
So one of the things about cancer is that it's something that the mutations that cause cancer sometimes need to accumulate over time. Okay, it's not just one thing that causes it. So the underlying abnormalities that cause it may need to accumulate, or you may need multiple of them to get them, and you're more likely to get them as you age and your cells age and your body ages. That's why it's a time effect. That's not to say that younger people don't get them. We know a lot of young people get cancer as well.
Do you know why that is?
Again, because cancer is so many different conditions, there's lots of different reasons. Some cancer is genetically driven. So it's down to your genetics and your DNA, and that makes you more likely to get it. There's very rarely just one thing that causes it. It's usually a combination of multiple factors. But as you get older, you tend to get more factors involved, and that's why you're
Yes.
more likely to develop cancer at a later age, particularly over the age of 50.
And I think what you said throughout this podcast so far is it's not just one thing. There's not just
Yeah.
one type of cancer. There's not just one cause.
Yeah,
We're oversimplifying things now
we are.
as much as we can to eliminate certain things. But if we did that, honestly, we would eliminate everything from our diet.
It's often a combination of different things, some of which may be completely out of your control.
Yeah.
And that's why, particularly, for communities that are less likely to come forward, that may be embarrassed, that might blame themselves, that might feel like they're being a burden and it's their fault, what I would say, often it isn't. There is
Right.
probably very little you could have done about it. Or, even if you've modified all the factors that you could do, you may still have developed it at some point in life, but at least you'll have reduced your chances. What I don't want people to think that is that if I'm going to get it anyway, what's the point trying?
Right.
Because it's all about reducing risk.
Yes.
So a lot of us, it will be about reducing risk as much as we possibly can do.
I just want to go back to the question I asked you around which groups are more affected by cancer and why.
Over the age of 50, definitely.
Yeah.
We know that it's more common in those age groups. But people with risk factors, that's the
Yeah.
thing. So if you've got a strong family history of cancer, then your risk level is up. If you smoke, if you drink too much, if you've got a diet that's rich in processed red meat, etc. If you get a lot of sun exposure, for instance, so people who, use sunbeds a lot, we know that that can be a risk factor. But we have screening programs for people on groups who may be more likely to develop it. And that's why I encourage people to use them, and particularly South Asian communities. Please, please, please. I know some of these screening programs are for intimate things,
Right.
like cervical cancer, like breast cancer. It's important to attend those because, as a general, as my parents say, if something is being offered to you on the NHS for free, there's a really
Right.
good reason for it. Because
Right.
it's usually, when something is offered on the NHS for free as a screening program, it has to prove itself that it's worth it, that it's helpful, that it's useful. That's part of the criteria for being a screening program. So it's there for a reason. So attend your screenings. And screenings are for people who don't have symptoms. The whole idea behind screening programs is to pick up things like cancer before you get symptoms.
Right.
That's the whole point. If you've got symptoms, you need to go and see a healthcare professional, and you need diagnostic testing. That's, specific targeted testing to look for certain things. Screening is for people who don't have symptoms. So usually screening is for people who are completely well. But those screening programs are usually aimed at people who are more likely to get certain cancers.
So talk to me about the process. Who qualifies for these screening programs actually?
It varies.
I think we actually don't appreciate how much we get with the NHS when we live in this country, because we just have access to it. We get so much access to so many other things like these screenings, like these tests, and we're offered them constantly. So why not take them? But I really want to go through the idea of, okay, let's say I've gone for a test. What happens next?
Yeah.
What if they found something? What are the steps that happen after these tests?
Yeah. So if you go and see a healthcare professional and you're worried about something like cancer, they will usually go through your history. They will look at your signs and symptoms. They might do an examination. And if they suspect it might be, because chances are it probably isn't, it could be something else completely unrelated.
Yeah.
If they suspect it might be cancer, then they will often refer you on for further testing. And that could be blood testing, or it could be a scan of some sort, or it could be referral to a specialist, sometimes rapid access clinic, to try and get you through that process quickly. So there's a number of different things that can be done. And what you're trying to do there is targeted testing. You've got a certain condition in mind, and you're targeting your testing towards that to see if you can pick it up, and that increases the chances of that test being accurate. That's how it works.
Yes.
And just because you get a certain result doesn't necessarily mean it's relevant, or that it's actually going to cause you a problem. And that's why we have healthcare professionals. They are trained to try and sift some of that out. If you're sitting at home and you're worried about it and you're stressing about it, it's not your job to decide whether it is cancer or not, because you're not trained to do so.
Right.
Even if you go and Google things like that, it's not your job to do that. What we want you to do is speak to someone whose job it is, who is trained to try and, increase the accuracy of that concern.
Yes.
Right? And the chances are it probably won't be cancer. But if it isn't, you'll get reassured, which gives you peace of mind, which is good. It may not be cancer, but it may be a different condition entirely that needs treating. Again, you'll get sorted out. If it is cancer, on the small chance it is, and you've picked it up early, fantastic, because your options are better now.
So true.
But if you sit at home and you fret about it, not only does that cause you stress and anxiety, but long term it could worsen your outcome. It's not a good idea to do that. But if something is worrying you and it's been going on for some time, particularly if it's getting worse, if you've got lots of different symptoms that aren't explained, we'd want to see you.
Just because someone has the ability to advise you, they're not the best person to advise you because they don't have the correct knowledge. So you shouldn't go to somebody who's not in the medical field and say, hey, I've got this symptom, and for them to say, oh, you shouldn't worry about it, it's a minor thing, you're a hypochondriac. Especially, it might be something.
Yes, and also, especially when we are so good at, being involved in and looking at social media.
Right.
There's lots of advice and information,
Yes.
especially on social media at the moment. Not all of it is helpful, not all of it is accurate, and not all of it is given by people who are experts in that particular thing. And social media is awash with all sorts of cures and treatments and health myths and fads and stuff like that. It is full of it, because that stuff sells. That stuff is exciting. That stuff gets people's attention. What I would say is be very, very cautious where you're getting your information from and who you're speaking to. And if something is concerning you, try to see and speak to someone who knows what they're talking about, who is trained to do so. And that's what we as healthcare professionals are here for.
I really want to talk about one point which I think people miss. In the South Asian community, I think a lot of people are very scared to share their diagnosis of cancer or any health concerns, because spiritually it's linked to karma. Yeah. And a lot of people say, well, it's your karma from your last life. Yeah. And that's why people are so scared to say it, because they think they're doing something bad in this life. They think it's karma from their last life. They think that this is a punishment.
Yeah.
Is
And
that true?
that's a cultural thing. Is it true? No, I don't think it is. It's a cultural belief.
Yes.
And it's not particularly helpful.
No.
One of the things with conditions like cancer is often we don't find a cause, and often it's not anybody's fault in particular. Yes, there are certain things that definitely will not help, like smoking and drinking too much alcohol. Yes,
Right.
we know that those things directly contribute to an increased risk, and therefore, we should try and modify those things as much as possible. But some people, there's a huge genetic component to cancer. That's why family history is such an important risk factor, because if there's a lot of cancer in your family, your risk gets higher and you can't necessarily do anything about that. I don't want anybody who has a diagnosis of something like cancer, particularly in the South Asian community, to feel like they brought it on themselves, because that's not helpful. Once you have a diagnosis of cancer, worrying about things like that will not help you. What's the important thing for you to do is access the treatments that you need, and generally speaking, as a community,
Yeah.
maybe educating everybody else about it as well. The other thing that I think some people find difficult and find problematic is talking about cancer as a battle. And yes, for some people, saying I'm fighting cancer can be really empowering. It can be, because it feels
Wow.
like you're actively doing something, and that
Yes.
mindset for some people is really important. We
Right.
must not forget that. Ideally, the sooner you pick them up, the better your chances.
Yes.
There's a great statistic here with breast cancer. So if you pick it up on stage 1, which is the earliest stage, most people who've got breast cancer will be alive 5 years later. Similar statistics we see in lung cancer, similar statistics we see in colon cancer, bowel cancer. The sooner you pick these things up, often the better.
Yes. I really love that point that you mentioned as well around it not being your fault, because I think I tried to weave that throughout this whole episode around shame. It really drives me mental, and I hate it when somebody says, oh, they're suffering with that because it's their karma. They're suffering with this disease because it was put on them. And there's this whole narrative around that, which makes people feel like it's their fault, which avoids people from coming forward and saying,
Yes.
hey, something's wrong.
And that's a big factor in certain cultures. And it's not just South Asian
No.
cultures, some others as well, that guilt,
Yes.
the feeling of shame, plays a big role in those
Yeah.
societies. And it's not necessarily helpful
No.
to anybody, to the individual or to those around them, because you're propagating that fear and you're stopping people coming forward.
Exactly.
That's something that it's going to take time to unweave that from our society. And I feel like, as a younger South Asian person, we are better at coming forward, and we are better at speaking up about stuff that previously culturally may have been a taboo subject.
Yes.
I feel like we are getting better.
Yeah.
But it's still important for everybody else to be, confident to come forward. And maybe it's up to us as younger South Asian people to try and impress that on other generations. I certainly try to do that with my parents. I've got to the point where I've made my parents appointments to make them go, I'm going to make you that appointment, because your hurdle for you is making that appointment, getting over that hump. Once it's made, it's easy. You just turn
good to
up.
go. Yeah, it's true.
So I've made the appointment for him, and he's been to it, and he's glad he's been afterwards. And we see that in surveys that people are worried about going to seek help, but once they've done it, they are grateful and glad that they've done it.
Yeah.
One of the things that we've started doing in this country is a bowel cancer screening program, where we send stool collection kits to people's homes. You can do it at home and you can send it back. It's an embarrassing thing to do. It's not something you would talk about over a dinner table, particularly in South Asian communities. You don't tend to talk about that sort of stuff. But it has opened up that conversation for me and my brothers and my sister-in-law to have that conversation with my parents and say, this is really important for you to do.
Yeah.
And they've been fantastic. My parents took it on board and said, do you know what? We're talking about it. That's great. I was so worried about talking about this, embarrassing subject. We're now talking about it. And they've done it. They've actually done the test and they've sent it back. And thankfully, touch wood, all good so far. Having those conversations, even about the embarrassing stuff, at the right time, in the appropriate way, I think is really, really important. The more we do it, the easier it will become.
And the more you can kind of make it jovial and be like, have you done yours? I'm going to do mine. Like, you can kind of make it fun.
Sometimes I think that has to be driven I feel like we live in very matriarchal
Yes,
communities where it's always a top down thing. You know,
correct.
we always go to the elders for advice or information
Right.
and guidance.
Yes,
Sometimes it has to be the other way around.
I
It's now
agree.
our job, I think, as younger South Asian people to educate other generations and maybe
100%.
impress and encourage them to do the things that they would not necessarily know about or be used to getting done or
Yeah.
be used to talking about. Maybe it's our job to reciprocate some of that now.
Yes. So
And that
true.
is a culture shift.
Yeah.
That really is, because we live in societies, in communities where the parents and older people basically
Yeah.
have dictated what happens and what should be
Yes.
done and have guided and been that source. Sometimes it
Yeah.
has to be the other
The
way
other way
around because
around.
we
Yeah.
live in a different society.
So
The
true.
other thing I encourage people to do is a lot of health information that's out there, particularly around things like cancer, is in English. And
Mm.
that's not always useful to people who speak a different language.
Mm.
There are lots and lots of resources from various NHS organisations that have translated it into Bengali, Punjabi, Hindi, Gujarati, Urdu, all of that stuff.
Wow.
Really important for you to access that. It's easy.
Mm.
Type it into a search engine. And
Yeah.
if it's an NHS website, chances are it's an accurate resource and a useful
Mm-hmm.
one and a reliable one. Give them that information in their
Yeah.
own language. Sometimes when people see information in their own language, they immediately engage with it better.
So true. I love that. Before we close, what's one thing that you would tell people to do at home right now to help them look out for a sign of
Yeah.
cancer?
Please do not be embarrassed about coming forward if you're worried about something. As doctors, if you suspect cancer, we want to see you.
Yes.
Okay. And we've seen it all before, no matter how embarrassing or intimate it might be. Please come forward. It's nothing we haven't seen before. It's
Mm.
nothing that is going to surprise or shock us.
Mm.
And we'd much rather you came forward and we reassured you than
Yes.
you came forward late and then your options are very, very different and things get a lot more tricky.
So
The
true.
other thing I want to impress on people is if you've been to somebody and they've reassured you and said, it's okay, don't worry about it, or just watch and wait.
Yeah.
If things persist or get worse,
Yeah.
we want you to come back. Cancer is not a condition that's always easy to diagnose. So please don't sit at home and worry. Vast majority of cases, you're better off going and speaking to someone than sitting at home and stressing about it. In terms of prevention, the general thing I will say to everyone, because there is no one
Yes.
thing, the general thing I would say is try to make healthier choices wherever you can. It's
Yeah.
not always easy, it's not always possible,
Mm.
but try to. And I think getting the basics right is the
Yes.
most important thing for me. It's not about, oh, eat this particular thing or drink this particular thing or avoid this particular thing, because I don't think that's helpful. For me, it's getting the basics right, and that is
Mm.
looking after your sleep, and that is looking after what you're eating.
Yeah.
So we've talked about trying to eat more fruit and vegetables, cutting down on things like smoking and drinking, cutting
Mhm.
out smoking entirely,
Yeah.
ideally, and then physical activity, whatever your ability is within that.
Mm.
And bearing in mind, my mum is a 70-year-old Asian lady. She is not going to go down the gym because
Right.
it's not her environment, it's
No.
not for her, she doesn't
Yes.
understand it, and she can't do it.
Mm.
What she does do and what she can do is walk and do yoga.
Amazing.
Fantastic. That physical activity is better than nothing.
Yeah.
And for her, it's really, really good for her mental well-being and her physical well-being. So those are the three things I was always say to people. Just get those
Yeah.
basics right, first of all.
Thank you. I feel like this has been such an informative conversation.
I hope so.
But I know that you have more information on the nhs.uk/cancer symptoms
Yes.
website. So if anybody at home wants to know a bit more about the signs and symptoms, they can go there. Like you said, you can translate into other languages and just use a search engine. So
Yeah.
this has been really helpful because I think it's allowed me to break everything down
Mm.
so that everyone can understand that it's not so big and scary. And the earlier that we get diagnosed, the earlier that we can be helped.
Yeah.
And that's just a simple...
And the better your outcome.
Exactly. So thank you so much for
Thank
coming.
you.
Thank you.